Well, flu season is here, and just as the health department predicted, cases are up this year. Thank you for joining us tonight at 6. I'm Rolly Hoyt.
And I'm Faith Woodard. A majority of those cases are children, but THV11's Jalissa Garza shows us that's not the only virus parents should be on the lookout for.
And there actually are more cases of flu already this year in this year's flu season as compared to most Octobers.
Dr. Joel Tumlison with the Arkansas Department of Health says flu cases right now are higher than normal, and one age group is getting hit harder than others.
A lot of schools, etc., are seeing that. In fact, over more than half of the cases that we get reports on so far are in children.
This isn't the only virus that can impact kids right now. Health experts are still warning about COVID-19, but say fortunately those numbers aren't trending the same way as the flu.
COVID cases in kids are actually going down, and they have been for several weeks, just like the general population.
Dr. Tumlison says it's important to pay attention to symptoms, especially since the two viruses have so many in common.
Both can cause fever, both can cause cough, both can cause runny nose, sore throat, achy muscles, chills.
Another virus spreading among kids right now, RSV. Arkansas Children's Hospital tells us this is the second year in a row they've seen a spike. Adding in a statement, the emergency departments at our two hospitals are as busy as they've ever been because of respiratory illnesses. Many of these children require inpatient care, and some even need ventilator support on our intensive care unit. Dr. Tumlison says the symptoms of this virus can appear a bit similar to COVID and flu for older kids.
In an older child, RSV just might look like a cold or the flu or something like that. It can be more difficult to distinguish.
But for younger children, the symptoms can be more severe.
It can give them difficulty breathing, and often they'll wheeze.
While all three viruses are different, there are things you can do to help prevent them.
That's good hand washing. That's trying to keep hands and things out of noses and mouths. That's, if you're sick, wear a mask.
Dr. Tumlison also recommends getting the flu and COVID vaccines. In Little Rock, Jalissa Garza, THV 11 News.
Like Jalissa said, some of the symptoms can be similar between all of these illnesses, so we have them broken down on our website, thv11.com.